We're seeing today people having access to communication tools that were beyond the reach of the public health system for the past 3, 4, 5 decades.
Behavior happens in real time. And the way that we look at behavior right now is in these snapshots that are sort of encapsulated in like a survey or whatever, but that's not how behavior works.
Mobile technology can really provide so much data that can then improve people's behavior.
With the prevalence of non-communicable diseases matched with the increased growth rates of mobile penetration in areas where the need is greatest, creates a huge opportunity to affect change.
Wellness technologies have huge potential, and most of this potential is untapped.
So now we have the possibility to know what people are doing and to intervene or give them the information they need at the moment that's going to help them the most.
It can become an extender of existing treatments. So it may be that a person goes and sees a doctor and then would also be receiving an mHealth intervention.
There's huge opportunities for empowering patients and empowering communities and helping in training healthcare workers as well.
There is an opportunity of bringing the governments on board to apply mobile health solutions that will drive a dramatic and systemic change in the public health pathways.
Wellness provides two distinct opportunities. Optimize current interventions that we know well, get better information, real-time information, more relevant data to the people who are doing great work in the field, and to make those interventions that are working well work faster and harder and at greater scale.
There are inherent qualities of mobile tools that we're in the business now of assessing and evaluating which ones make the most sense for ministries of health and governments to invest in.
We don't want to be just one more project. We want to have a sustainable mHealth plan and develop it and make it.
There are a number of challenges that we face moving forward in this space.
One of the biggest challenges is not to be carried away by the technology for its own sake.
As soon as we think we have something and we start to evaluate it, the technology is old, the approach is dated.
Consistency of platforms.
Bringing the governments on board. They need to put money on the table and resources and leadership to make it happen.
In Senegal, we have big health priorities and we don't have enough resources.
Trying to find ways to develop a generic platform that can be easily moved to another country at very low cost.
How do we provide individualized information that makes sense to such diverse and independent populations?
One of the challenges I see is that everybody talks about challenges and obstacles instead of talking about assets.
We don't have to have the very latest version or iteration of a technology. We need to design for the user.
How to effectively use mHealth interventions to interact with low literacy populations.
We don't quite yet know what the true potential of these technologies are.
There has to be research behind the technology that's coming out, and there has to be a partnership in that. Otherwise, the myth and the hype in mobile health is going to overtake all the beautiful things that we can do with it.
To make sure that the enthusiasm that everybody has here can be used in the reality and in the field at country level.
Wellness really captures the essence of the transdisciplinary nature of global health.
Traditionally, we tend to think of like, I'm a diet person, I'm a smoking cessation person. What I would really like is for this group to take away that there are commonalities across all of the health behaviors that we're trying to intercede in.
We often talk in global health about the need to partner with the private sector, to engage with governments and academia and civil society. But in practice, it doesn't happen very often. And this workshop really gave us the opportunity to provide a forum where all the different partners could come together and really share common objectives. And although our rationales and the initial reasons for our engagement may differ, we all have very similar goals when it comes to wellness.
There is a massive possibility here, and so that's why I believe all this expertise is being gathered.
I see a lot of partnerships evolving. I see possible research coming out of this.
The need to be agile and consistently looking at the future and at innovation. And it's something that in academia we're not necessarily so good at, and at the governmental level we're also not so good at. And it's something that the private sector has excelled in.
What are some of the things that could move mHealth forward really quickly? And I think the development of new research design, the endless hammering on funding.
This is what everyone's going to be engaged in some level if you're involved in global health in the future.
This is the beginning of something that it is going to happen and is going to be very big.